Taking care of yourself after a groin, inguinal, hernia repair. So, you have just undergone a repair of your inguinal hernia and are now heading back home after your surgery. What's next? How do you take care of yourself? What to do and what to avoid? This video will hopefully provide you with some general guidance on postoperative recovery and care after hernia surgery. The most important information for your postoperative recovery and care will always come from your surgeon. Your surgeon will generally provide you with discharge instructions for your care after surgery, in written and verbal format. If you have questions or problems related to your postoperative care, you should contact your surgeon and talk to her or him, or their support teams. This video is only intended to provide basic information about postoperative recovery and not intended to take the place of specific instructions provided by your hernia surgeon. Pain after surgery. Surgery using incisions will cause pain and discomfort at some point after the operation. Generally, this pain will resolve as healing occurs. One of the first things you can do is to use ice to the incisions for local control of pain. You can use ice packs or simply put ice in a plastic bag and place over the incision, on and off, as needed. This cooling effect has been shown to provide effective pain control. Your surgeon may also prescribe opioid and/or non-opioid pain medication. Non-opioid medications include ibuprofen, same as Motrin and Advil, and Tylenol. Examples of opioids include oxycodone, OxyContin, roxicodone, etc., and oxycodone with acetaminophen, Percocet. Recent studies have shown a significant decrease in the use of opioid medications among patients who undergo inguinal hernia repair. Most patients, according to studies, do not require any postoperative opioid medication for pain control at all. A proper combination of ice, ibuprofen, and Tylenol may generally alleviate postoperative pain after inguinal hernia repair for many patients. Your hernia surgeon will be your best guide for information regarding your postoperative pain control. Opioids can have significant unpleasant side effects including nausea, vomiting, constipation, urinary difficulty, sleepiness, impaired thought, and breathing problems. Activity. Most patients can, and should, resume basic activities of daily living very soon after inguinal hernia surgery. This will obviously depend on levels of fatigue and pain after the surgery. Guidelines for inguinal hernia surgery recommend that work or leisure activities could safely be resumed 3 to 5 days after the operation. Recent guidelines for inguinal hernia surgery recommend resuming full physical strain, sports, and hard work possibly 2 to 4 weeks after the operation. The return to full physical strain and heavy lifting depends upon hernia size and type, details of the operation, patient factors, weight and size, age, type of work, other medical problems, and many other factors. The restrictions of return to activity and full physical strain and heavy lifting after inguinal hernia surgery should be based on your discussion with your individual surgeon and take into account your unique circumstances. In general, patients can return to sports between 4 to 8 weeks. However, exact timing of return to sports can vary from a few weeks to several months. This depends on many factors including the type of hernia and surgery, patient factors, the type of sport you play, discussion with your surgeon, and how your recovery is going. Let pain be your guide. If you are having pain from doing an activity, you should stop the activity until further healing, and contact your doctor for further advice. Sexual intercourse. The anesthesia may leave you fatigued, so it would not be surprising if you didn't feel up to having sex for a while. In men who undergo repair of very large hernias, there might be bruising and swelling of the scrotum, penis, and testicles in the days after the procedure, making sex painful. In general, if you want to have sex and it does not hurt, it should be okay to resume sexual activity several days after hernia surgery. A small percentage of patients will experience temporary sexual difficulty after inguinal hernia surgery. It is important to have this frank conversation prior to surgery with your surgeon. Follow your doctor's recommendations for how long to wait. When you feel ready to try having sex, first try a position that will not put pressure on your abdomen or groin. Eating and weight. In general, there are no restrictions on what you can eat after inguinal hernia surgery. It is advisable to avoid any significant weight gain as obesity is associated with return of the hernia after surgery. The best advice would be to eat a healthy and balanced diet. Try to avoid foods that make you constipated and result in straining during defecation. Follow up with doctors and medications. You will generally have a follow-up appointment after surgery with your hernia surgeon, usually in 1 to 2 weeks. Any further follow-up will be determined by your surgeon. You should also visit your primary care physician after surgery, especially if you are being managed for other medical problems such as diabetes or heart disease. You may need readjustment or restarting of medications that may have been stopped for surgery, such as blood thinners. Under the advice of your doctors, you should be able to go back on your medications after surgery. Surgical incisions. In general, your incisions will be closed with dissolvable stitches underneath your skin. The incisions are then secured with surgical glue or adhesive strips to hold the wound closed while it heals. You should not remove the glue or adhesive strips. They will come off by themselves during the healing process. You should be able to shower in 24 to 48 hours after surgery, but you should check with your surgeon first. The incisions should be kept dry as much as possible. It is best to avoid soaking in a bathtub, hot tub, swimming pool, or other water, until the healing is complete. Try to avoid sunbathing, as sunburn can darken the scar during healing. You should call your surgeon's office if you notice any of the following: bleeding, worsening pain, redness and drainage of the incision, fever over 100.5 F, difficulty urinating, or nausea and vomiting. Driving. It is safest to avoid driving or operating heavy machinery until 1. You are no longer having pain, and 2. You are no longer taking pain medication. When you restart driving, consider a few test drives that are slow and short distance with another experienced driver in the car. If you drive a truck, school bus, or other heavy vehicle, you may have to wait longer after surgery to drive. It is best to discuss this with your surgeon before surgery. It's important to keep in mind that everyone's recovery is different, and your surgeon may have specific instructions for you.